Hi and welcome back to my channel Health and Wellness. Today we are going to discuss a very important topic that could potentially save lives. We are discussing the 9 warning signs of a stroke that can appear 1 month before. Recognizing these signs early can potentially save a life. So let's get started. First, let's understand what is a stroke. Stroke can occur when the blood flow to the brain is interrupted or reduced. Due to this, brain cannot get oxygen and nutrients from the blood. Brain cells begin to die in minutes. This causes the stroke. Prompt treatment is crucial as it is a medical emergency. Now, let's discuss the 9 warning signs of a stroke that can appear 1 month before. Recognizing these signs early can potentially save a life. 1. Sudden headaches. If you or someone you know is experiencing sudden severe headaches without a known cause, it could be a warning sign of a stroke. Don't ignore this symptom and seek medical attention immediately. 2. High blood pressure. This is the most important known risk factor for stroke. It can lead to blood clots in the brain and can damage the tiny blood vessels inside the brain. It can also make a stroke due to bleeding in the brain. Remember, the higher the blood pressure, the higher the risk of a stroke. 3. Trouble with vision. Experiencing sudden trouble with vision in one or both eyes can be a sign of a stroke. This can manifest as a blurred vision, double vision, or even loss of vision. 4. Difficulty speaking. Slurred speech or difficulty understanding speech can be a warning sign of a stroke. If you notice this symptom, it's crucial to seek medical help right away. 5. Confusion. A sudden onset of confusion, trouble with understanding, or difficulty in concentrating can be a sign of a stroke. This is because a stroke can affect the part of a brain responsible for cognition. 6. Loss of balance. If you notice a sudden loss of balance or coordination or trouble in walking, it would be a warning sign of a stroke. This happens when a stroke affects the part of the brain that controls our balance and coordination. 7. Numbness or weakness. Experiencing numbness, weakness, or paralysis on one side of the body, including the face, arm, or leg, can be a sign of a stroke. This is a serious symptom that requires immediate medical attention. 8. Dizziness. Sudden dizziness or a sudden severe headache can be a warning sign of a stroke, especially if it is accompanied by other symptoms on this list. 9. Difficulty swallowing. Difficulty swallowing or a sudden onset of drooling can be a sign of a stroke. This happens when a stroke affects the part of the brain that controls swallowing. Additional to the 9 warning signs we discussed above, you can also consider unexplained fatigue as one more sign for stroke. 10. Unexplained fatigue. Feeling suddenly fatigued or exhausted for no apparent reason can be a warning sign of a stroke. If you are experiencing unexplained fatigue along with any other symptoms on this list, seek medical help immediately. Here are some of the risk factors for stroke. 1. High blood pressure. This stands as the primary risk factor for stroke. It might deteriorate the blood vessels responsible for blood flow to the brain, which leads to blood clot in brain. This results in a stroke. 2. Heart diseases. It is the second most significant risk factor for stroke. 3. Smoking. Regular and heavy smoking is a significant risk factor for ischemic stroke. It results blood clots in the brain and harms blood vessels. 4. Physical inactivity. Not getting enough physical exercise is the second largest risk factor for stroke. It may result in high blood pressure, diabetes, and high cholesterol. 5. Heredity or genetics. Family history also plays a major role. People having history of stroke are more likely to develop this condition. Preventing measures of a stroke include controlling risk factors like obesity, high blood pressure, not getting enough physical exercise, a poor diet, alcohol use, and inheritance. reducing the severity of a stroke. Even if a person has a stroke, controlling risk factors can help lessen its effects and increase recovery prospects. For instance, managing high blood pressure can lower the risk of repeated stroke and prevent additional damage to the brain blood vessels. Improved general health, adopting healthier habits like balanced diet, regular exercise, and quitting smoking can reduce stroke risk. Remember, recognizing these signs early and getting immediate medical attention can make a huge difference in recovery. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to Health and Wellness by Dr. Uma Devi for more health tips and advice. Stay healthy and stay happy. See you in the next video.